Welcome. I'm Carine Legault, Patient Support Specialist at Colorectal Cancer Canada. Thank you for joining our most recent Tush Talk, Understanding Lifestyle Trials. We will explore today how certain types of clinical trials are used to measure the quality of life of cancer patients with a focus on lifestyle factors such as physical activity. We are joined today by Dr. Nicole Culos-Reed, a professor of health and exercise psychology at the Faculty of Kinesiology, adjunct professor in the Department of Oncology in the Cummings School of Medicine, and director of Health and Wellness Lab and Thrive Center. She holds a research associate appointment with the Department of Psychosocial Resources at the Tom Baker Cancer Center, Cancer Care Alberta Health Services. Her research takes a multidisciplinary approach to understanding and improving the quality of life of individuals living with and beyond cancer, developing, delivering physical activity programs addressing both the physical and psychological challenges experienced throughout treatment and into survivorship. Thank you for joining us, Nicole.
Thank you for having me.
So we'll start off, I think, by exploring a little bit what are lifestyle trials. I know they can involve different types of things like nutrition, sometimes physical activity. Can you explain a little bit more about them?
Yeah, so you're exactly right. They are trials that look at non-pharmacological interventions, right? So if you think of lifestyle behaviors, your big ones would be physical activity or exercise, nutrition, sleep, and stress reduction. And so within those, you could have a whole host of different interventions. You might be looking at complementary and alternative therapies within nutrition, for example, mindfulness, meditation, that type of therapy, or in the world that I live in, the role of exercise or movement as the intervention.
Fantastic. And how do these clinical trials differ from like a medication or a treatment trial?
I think the biggest factor is really the control group, right? And so when you are in a drug trial, what many people consider, your standard clinical trials across medical settings, there's often a placebo given. And so individuals do not know if they're in the active intervention or not. Really hard to do when we're talking lifestyle trials for the most part. If you're in the exercise intervention, you're in the exercise intervention. You can still have that traditional waitlist control group, so the group that gets nothing. But more often, we're often seeing that it's an active comparison group. So for example, in the exercise world, we might look at a stretching program in comparison to a strengthening program, or a combination of programs in comparison to one type. So there's a lot of different ways you can look at it. But I would say that the biggest difference really is that individuals know the group that they're in, as do the individuals working with them. So there isn't that blinding that we typically see as a hallmark in traditional drug trials.
And why are these types of trials so important? I see a lot of them out there, and we encourage people to enroll, but we want to know a little bit more why they're so important to cancer research.
I think what we've seen in the cancer field is an increase in acknowledgement that there's a myriad of factors, and many of them are lifestyle related, that can impact outcomes for individuals, as well as their management of symptoms through treatment and their overall quality of life. And so these trials are really important because they gather our best evidence, right? Because they are a more controlled trial. So they gather very strong evidence looking at the role of one of these lifestyle interventions on specific outcomes. So we can say, for example, from the exercise literature, that we absolutely have the evidence that exercise is a very important tool to help diminish cancer-related fatigue. So we have the lifestyle trials, the clinical trials that actually show that outcome of exercise in comparison to a control group or in comparison to another active intervention, that it does positively impact cancer-related fatigue. So as the evidence builds from these trials, we can then consider moving from the strictly controlled trials to the implementation types of research and continue to measure their effectiveness in more real-world settings, i.e. not as tightly controlled.
And ultimately, on the long term, is maybe the interventions from or recommendations from physicians, nurse, and the treatment team will then be modified according to all the discoveries we've made in these different researches.
Exactly. I mean, if you're a clinician, you're looking for that highest level of evidence. And as that grows, they can then build that into their standard practice, whether it's recommendations, whether it's being able to refer individuals directly to resources within the cancer care system. And so I think these trials are absolutely essential. And the more we can get patients while they're on treatment or after treatment and into survivorship, going through these trials to actually find the tools that they can use to help really enhance their well-being. And I think the other important part of some of these lifestyle trials is that they give the opportunity for patients, for participants to regain that sense of control that being thrown into the cancer care system often takes away. Mm-hmm. And so they learn some actual skills, or they learn some new behaviors that they can use to help then manage their overall well-being, which is a novel component to really what is considered standard cancer care.
And I understand from some patients, or experience from some patients, is they also have access to interventions or activities that they wouldn't necessarily have in their normal cancer linear passage. Is that correct?
Yeah. I mean, if you think of what cancer care encapsulates right now, it's really the traditional treatments, right? And then there may be some add-ons. They might have a psychosocial resource piece. They might have rehab oncology for some more dealing with really negative impacts or different side effects, whether they're physical or psychosocial. But typically, individuals don't have standard lifestyle behaviors, whether it's a stress reduction program, a sleep program, exercise program, or nutrition that's really built into standard care. And so participating in these trials not only helps us, the research team, build the evidence, but it gives the participants, as you said, access to really a tool where they may see immediate benefits for themselves. So they're not only helping add to the evidence for the long term for us building this into standard cancer care, but they might actually gain really some pretty immediate benefits to enhance their well-being and overall quality of life.
And you touched a little bit on it, but these types of trials are open to what type of individuals?
It really does depend on the trial and the criteria they have, but typically they are, across the board. So they may be individuals who are on treatment. They could be even prehab, so individuals from diagnosis before treatment commences. And then a lot of them are into the survivorship phases, so after treatment or living with advanced cancer. So we're seeing really lifestyle behaviors have a role across that entire cancer continuum, and there's trials with different questions that would be placed at different times along that continuum of care.
And once you enroll in these types of trials, is there usually a time set period that you're enrolling for? A few months, a few years, depending on the trial?
Yeah, the trials really do vary. I would say most of them have an active intervention period, which, it could vary. It might be really intensive for 4 weeks. Our exercise trials are generally a 12-week intervention. But then really a lot of the key questions we are asking require a follow-up period. So it may not be active intervention. They may have access, though, to other resources. But then there's measurement time points, tracking people out as long as we can. Because when we think about lifestyle behaviors, we're really, during the intervention, trying to help people build the skills so that they can continue to use it. For most of these behaviors, just like taking a pill, you're not going to get the benefits unless you continue to do it. So follow-up periods are very important in lifestyle trials.
And I'll talk specifically about your trial that you're currently conducting, but are there specific safety protocols in place with these lifestyle trials that are versus like medication? We know that there are specific things that you have to respond to be able to enroll in the trial. I'm assuming lifestyle trials are pretty much the same thing.
Yes, exactly, Carine. They have the same strict criteria in terms of eligibility criteria, right? Because we're trying to control as many factors as possible when we're in those trial phases for many of our lifestyle trials. When you move forward into implementation trials under that category, you would still have inclusion criteria. You'd have a strict screening process. And really it is about, in all of these trials, safety first and then potential benefit second. So there's protocols in place, there's ethics in place to ensure that participants are coming in and to be a safe and then potentially beneficial experience in the trial.
I'm assuming it's the same thing with the medical information that's gathered during that period, the privacy aspect of it?
Absolutely. So when an individual comes in, their participant data is considered confidential and held securely. So there would never be any individual data shared. Really, it's about getting the numbers into a trial so that statistically we can look at those relationships. And so the data is basically all looked at together. And so there'd never be the potential for an individual to have any of their data looked at separately. However, that being said, one thing that we've done in many of our trials is we give participants their own information back. So for example, when we do fitness testing, we can give them that information so they can see where they're at, and then they can see the changes they make over the course. So it's really a participant-centered approach where we give them their information back so that they have that, again, sense of control, and they can see the positive impact that engaging in the intervention can have for them.
And your current research that you're doing at this moment, do you want to tell us a little bit about it?
Sure. The trial that would be relevant perhaps to your audience is called EXCEL, Exercise for Cancer to Enhance Living Well. This is funded by our national body, so Canadian Cancer Society and the CIHR, and in Alberta, additional support from Alberta Cancer Foundation. And this is one of those lifestyle trials. It's an effective implementation study. And what we're really doing is looking at the role of exercise to increase physical activity levels, because we know higher activity levels is associated with better outcomes, management of symptoms, quality of life, but also potentially decrease recurrence and improve survival. And so this is a large Canada-wide study for any individual who is pre-treatment, on treatment, or up to 3 years post-treatment, who is interested in an exercise intervention. And so as part of the process, they are screened coming in to make sure it's going to be safe and okay for them to participate. They're assessed at baseline, and then they get 12 weeks of an exercise intervention with 2 classes per week. Because it is across Canada, and we're really targeting outreach to try to get people that wouldn't have access to exercise oncology resources, it's all delivered online. And so we have Zoom-based exercise classes that go on that are supported by hubs across the country, and it's for all cancer types. So colorectal cancer, breast cancer, prostate, you name it. If they're screened and able to come in, they're eligible for this study. Then they're assessed again at the end of the 12 weeks so we can see the intervention effects, but then we also track them. So there's assessment periods 6 months later, 1 year later, and then follow-ups yearly up to 5 years. And so really it is about looking at, can we build that exercise habit in individuals and support them in that behavior change, give them access to a resource that they wouldn't have. So targeting people in more rural, remote communities in particular, to see if we can build this really into being something that is offered as part of standard cancer care.
What happens to all the data that you collect afterwards once the collection phase is done?
So because our recruitment period will be for almost 5 fully repository in a secure format, it's an electronic data capture system called REDCap. So participant data is all stored in there. It's anonymous. There's no identifiers within that database. And then as soon as we finish our last participant recruited and have the measures, that's when we get to do the analysis and look at all of the intervention effects and some of the specific sub-studies or questions in there. The data is then stored and held securely as per our ethics requirements for up to 5 years. And after that, it would be securely destroyed. So it's held anonymously until we finished all analyses, and then we get rid of it all. But it is all electronic in the case of this study.
And once you have your research papers available or your research done, would patients be able to access that if they would wish to do so?
Absolutely. And our lab is actually very big on the knowledge translation aspects. So we will share, we have for example, a quarterly newsletter that goes out to all of our EXCEL participants, and it updates them on, where's our recruitment at, and maybe some of our interim markers of success. So how many hubs we have going, different sites. And then as we build up to publications, we do the traditional journal publications, which, I'm not going to fool myself or anybody else. Pretty much no one's reading outside of academia. So we take that and put it into infographics, and we'll do one for our healthcare providers, one for our fitness professional network, and one for our participants. And so that way we can share with them in a really visually appealing, easier to read format. What have we just published? And what does this mean for them in particular? So I think that's a really important part of what we do is that distilling of the information down to our key networks, our participants, healthcare providers, and for us, our fitness professionals, so that they can see the impact that this is having and that they have had as a participant. I think it can be very empowering when they see that.
And I'm assuming lifestyle trials, or like any other trials, if at some point somebody enrolls and for whatever reason they cannot continue to do the trial, they would be able to stop.
Absolutely. Participants are 100% in control of this experience. And so whether it's they just didn't like it, which we don't typically see, or if it's, maybe they've had another health issue and they can't do it, or return to work and too many barriers come up, right? For any reason whatsoever, they're free to stop at any point in time. And then they can either request withdrawal of their full data. Most people typically don't. They just end their enrollment. And then depending on what we've collected, we can use some of it to just better understand, reasons for withdrawal. It's an important outcome and thing that we actually look at within these trials.
Interesting. Nicole, it's incredible the work that you guys are doing. I think it's such a great part of bringing cancer care forward and also into survivorship. It's fabulous. Some of these research trials can be found on different websites. So I know like 3CTN can be a place where we can find these researches. Here in Quebec, we can use QCRO or Catalyst to find these research trials as well. And also, I'm assuming sometimes, like you said, you communicate with newsletters or other ways that what trials are going on.
Yeah, so we do use our newsletter. We do have our trial registered with the clinical trials registration process, so it can be found there. And also, before I forget, exciting news, we actually are doing French translation of all of our Excel programming. So we have a team in Quebec that's, as we speak, translating everything. So we will be able to offer it in French to our French-speaking cancer population, which is very exciting because most trials in exercise oncology across Canada have been done in English only. So that's a major barrier that we're addressing in this trial. And so there's different ways people can find out about it. There's also information on our website. So Thrive for Cancer Survivors is our website at the University of Calgary, and people can absolutely go there to see more about the trial.
And if they have questions, they would be able to contact directly your team to obtain a bit more information?
Yes, absolutely. There's email links there to my wellness lab at ucalgary.ca, and they can contact that and get a hold of Juliana, who is our amazing research coordinator for Excel.
Thank you very much, Nicole. I appreciate immensely your time, all the information you've provided. If anybody watching this video has any additional questions for myself or for Nicole, you can go ahead and write to support@colorectalcancercanada.com. We'll be happy to answer those or pass those on to Nicole. We'll be able to answer and complete any information that we missed during this talk. Thank you very much for joining us.
Thank you for having me.